A kidney stone diagnosis begins with sudden, blinding agony as a jagged crystal scrapes through your delicate internal pathways. Once the immediate panic settles, you face an agonizing choice. You either wait in painful uncertainty, hoping it passes, or you schedule a costly, anxiety-inducing surgery. Many patients treat this waiting period as a test of endurance, but successfully passing a stone has absolutely nothing to do with your personal pain tolerance. The actual objective is protecting your organ. A stuck stone threatens to cause irreversible damage to your kidney function. Waiting it out is a calculated medical strategy. It requires active monitoring and specific daily interventions to ensure the stone progresses safely. This strategy operates under two strict, non-negotiable biological constraints: a specific physical millimeter limit and a 30-day countdown clock. Relying on blind optimism and drinking extra water won't save you from the operating room. Avoiding surgery means strictly managing the variables to keep your kidney safe. This diagram compares different stone sizes against the diameter of a standard human ureter. The primary biological threshold dictating treatment is the 6 millimeter mark. Stones measuring under 6 millimeters have favorable geometry to navigate the urinary tract naturally. Your probability of success here is high. Once a stone crosses that boundary, the physical reality of your anatomy works entirely against you. For stones larger than 6 millimeters, the probability of natural passage plummets to between 10 and 20%. At 10 millimeters and above, the chances drop to near zero. These stones almost never pass naturally under any circumstances. Trying to grit your teeth through a massive stone means enduring weeks of severe pain, only to end up on the surgeon's table anyway. Ignoring the physical math guarantees unnecessary suffering and delays a medical intervention that you will inevitably need. Physical size isn't the only metric. Specific physical reactions can instantly invalidate the wait-and-see approach, regardless of how small the stone is. If you experience sudden fever, uncontrollable pain, or pus in your urine, the waiting period is over. A complete blockage causes hydronephrosis. Urine fluid backs up, stretching the kidney walls outward under intense, throbbing pressure. That trapped, static fluid acts as an accelerator for bacteria. What starts as a simple blockage rapidly evolves into a severe internal infection. This triggers the risk of sepsis, a life-threatening condition where the localized kidney infection breaches your urinary tract and spreads into your bloodstream. In extreme cases, a condition called pyonephrosis develops. The blocked kidney fills entirely with pus, threatening the total loss of the organ. These red flags instantly change your treatment path from elective observation to an emergency surgical extraction. When red flags appear, surgery is the required rescue mechanism to prevent a potentially fatal outcome. The ideal candidate for natural passage has a stone between 4 and 6 millimeters, with absolutely zero red flag symptoms. Even then, doctors don't recommend passive waiting. They prescribe an active intervention called medical expulsive therapy. This checklist shows the rigid daily protocol. You take alpha blockers to relax the ureter, aggressively drink 3 to 4 liters of water, and monitor pain. This therapy comes with a strict expiration date. You have a maximum window of 3 to 4 weeks. If you are trying to tough it out, understand this dangerous illusion. A sudden drop in pain does not guarantee the stone has actually passed. Leaving a stone lodged in your ureter past 4 weeks causes strictures, severe scarring inside the urinary tract that makes any future surgeries highly complex. It also exposes you to silent kidney failure. A prolonged, painless blockage quietly destroys the organ's ability to filter blood permanently. Watchful waiting is tied to a ticking 30-day clock. Failing to pass the stone within this window turns passive patients into active organ damage. By synthesizing the math, symptoms, and timeline, we can map out a definitive evaluation matrix. This 3-column scorecard lets you categorize your current status. The safe waiter profile requires your stone to be strictly under 6 millimeters. You have 0 fever, manageable pain, and you are currently under the 4-week mark. Your required action is to commit entirely to the medical expulsive therapy protocol, hit your daily 4-liter water target, and monitor your symptoms carefully. The ticking clock profile is for the highly stoic patient. Your intense pain has subsided, but you've let the stone sit unmonitored for over a month. Stop avoiding the doctor. You must demand an immediate rescan to rule out silent kidney failure. The surgical route applies to any patient with a stone 7 millimeters or larger, or anyone presenting with fever, rising creatinine levels, or unmanageable pain. If you fit this profile, stop delaying and immediately book the surgical procedure. Surgery provides the mechanical intervention needed to physically extract the threat and preserve kidney function. The rules remain absolute. Respect the 6 millimeter dividing line and never ignore the 30-day biological expiration date. Successfully navigating a kidney stone diagnosis relies entirely on matching objective biological data to the correct medical action, rather than gambling with your pain tolerance.